Improving Physical Activity in the African American Community by Angelique Falcon. Physical inactivity is a leading cause of premature death, disability, and other comorbidities, with African Americans in the United States being affected at a higher proportion than white Americans. The 2007 Morbidity and Mortality Report showed that white Americans were 1.2 times more likely to meet the CDC guidelines for physical activity than African Americans. This holds true as more than 56% of African American adults do not meet the guidelines recommended by the CDC. As a result, African American adults are more likely to be obese than compared to non-Hispanic whites and eat fewer vegetables than other racial and ethnic groups. Improving physical activity in the African American community is a public health concern. The Get On Your Feet campaign seeks to address this issue. The CDC recommends that children through adolescence receive one or more of moderate to vigorous physical activity daily. Adults up to 64 years of age should receive 150 minutes of moderate intensity activity for at least 2 days a week. Adults 65 and older have the same recommendations mentioned, but with additional movement to help improve balance and cognitive ability. The campaign will provide pedometers to help track activity and steps. For those who may be a little bit overwhelmed with the new technology, those pedometers will come in handy. Group meetings will be held weekly and will include nutritional tips, sign-ups for walking groups, and a reimagined healthier recipes that will still respect the cultural values and belief systems. Social and environmental barriers will be discussed at the weekly meetings with feedback to be shared with stakeholders. Facilitators will provide a support system that uses motivational and reminder text to keep the families engaged. The Get On Your Feet campaign will kick off with a simultaneous media presence on social media, along with a press release. Newsletters and hand cards will be posted in the community and distributed at schools, apartment complexes, grocery stores, and local health events. The newsletter and hand cards have a QR code that, once it's scanned, will send the future participants to our website to sign up online. The campaign's intervention will be based on the health belief model, which is a value expectancy theory that, by increasing physical activity, the perception is that one will acquire better health and wellness while remaining respectful of cultural beliefs and work-life balance. The team will look to churches and community leaders to help guide the campaign and ensure needs are being met throughout the length of the program. Support staff will match the group's ethnic diversity as a way to build trust. Tailored, age-appropriate goals will be set by the support team, composed of public health educators, nutritionists, counselors, and local healthcare providers. The Get On Your Feet campaign evaluation tools will be used before, during, and after the campaign to assess effectiveness. Some notable key questions are: did we reach the targeted audience? What did they learn from the campaign? Was a new health-seeking behavior implemented? Did the targeted 150 minutes 2 times a week remain a lifestyle change? The ongoing evaluations will take place in weekly group meetings, and again at 6 months and at 1 year, with alternate contacts via phone, mail, and online surveys. Thank you for your time, and remember, get on your feet.